Hello. Hi, very good morning to all of you. Welcome back. Today we are going to discuss the case note of Rosalind Hinds, a 6 days old infant who has the diagnosis as low birth weight and opioid dependence. Now let's go directly to the task we have here. You are the charge nurse on the maternity ward where Rosalind Hinds was born, and need to write a letter to the local community midwifery team outlining relevant information and requesting discharge follow-up. So what is your task is to outline relevant information and requesting discharge follow-up. You are addressing the letter to the community midwifery team, as you are the charge nurse in the maternity ward. So this is the task. You need to get the background information which is relevant to the situation, and you need to you need to request discharge follow-up from the community midwifery team for Rosalind Hinds. Now let's go ahead. Rosalind Hinds, 6 days old infant of Janet Keating. She is single. You can see that she is single, and she is she has been using heroin, and she's dependent to heroin for about 2 years from now. So it means before 2 years she started using heroin, and right now she is dependent to it. Now you can see that she recently worked as a sex worker, and she had a strained relationship with the father of Rosalind because he showed domestic violence towards Rosalind during her pregnancy. So she had an estranged relationship with the father of Rosalind, her partner. Now she's getting support only from her mother. That's Rosalind's grandmother is very supportive, and this is the first child. Is a 22-year-old girl, delivered a baby of 6 days old. Right now it's 6 days old. It's you have reported this matter to the Department of Community Services, and but approved discharge living situation as long as the grandmother. So now you have to make the situation of the baby safe. So the Department of Community Services will approve the discharge only when the baby and mother will live at the maternal grandmother's house. As long as they live in the maternal grandmother's house, the Department of Community Services will approve the discharge. So this is something very crucial here. So this is needed. So this is some you have to report to this community services if you have any complication during the care at the grandmother's house. After discharge, if you have any complication, or if you find the baby in an unsafe condition, you have to report to the Community Services, Department of Community Services. This is something which is very crucial in this letter. Now we have the medication history. We do have medications, and that will be forwarded by the doctors. And we do have the progress. So we have the drug and alcohol team involved in managing Janet's ongoing addiction issue. And this was during hospitalization, and they have completed the mother and baby's withdrawal of heroin without complications. So the service of the drug and alcohol team were successful in managing Miss Keating's ongoing addictions use, the mother's addictions use. Okay. Addiction issues were resolved there at the hospital. During the stay, withdrawal was done successfully. Now the patient just gained weight for around 300 grams at discharge. Now we do have a problem here, low birth weight because of something else. We do have bottle feeding erratically, and we do have queries of appetite, that probably because the baby does not have enough appetite there. And we can say sure that the mother and the baby don't have a strong bonding between, and the mother needs prompting to care for baby. Okay. So drug and alcohol team. So what we have mentioned earlier. Now we do have to request the team to the local community midwifery team to visit the baby and the mother and the grandmother at the grandmother's house until the baby's weight is stable and the feeding is stable. You have to ensure the safe environment. And if any complications, report to the Department of Community Services. At the same time, you need to monitor the mother's coping and psychosocial stage, and you have to integrate the service to the drug and alcohol team. You need to educate mother and grandmother for infant care too. So let's go ahead with the letter, what we have. We don't have to explain it further. 28 April 2011, that's the discharge date, it's correct. The address is correct. Dear Sir or Madam, Rosalind Hinds, date of birth is given. I'm writing to refer Rosalind Hinds, 6 days old underweight baby, so it's low birth weight baby, who was born to Miss Janet Keating, who is an opioid dependent. Both require daily follow-up visits from your facilities following their discharge today. So they are going to discharge today to the grandmother's home. So you need daily follow-up visits. So this is the request. Rosalind is just 2.3 kg and has been not consistent with feeding since birth. Right now, the baby's weight is 2.3 kg. That's what we have said, low birth weight, and has not been consistent with feeding since birth. She has erratic feeding, what we have seen there, which is likely to be because of a poor appetite. This may be probably, that was a query there. So that's what we have written there. Miss Keating, so I just go with the Janet instead of Keating here, because in the case note, it was given like that, Janet, okay. Miss Janet has poor bonding with the babies, because it was given Janet, right? Yes, Janet. Miss Janet has poor bonding with the baby and requires prompting for baby care. During hospitalization, the drug and alcohol team was successful in completing the heroin withdrawal for both the mother and baby. So for both the mother and baby, the heroin withdrawal was a successful story, and this was done at the hospital. So this was the initial paragraph. Now we do have the background history of Rosalind. Rosalind is the first baby to her mother who has a 2-year history of heroin dependence. Okay, this is the first baby. This is her first pregnancy. And again, I have to go with the Janet, Miss Janet. Just because I know it is skating because it is given in the case note, it's Janet. So they call Janet means its addressing name is already given in the case note as Janet. So that's why we have given Janet as here instead of Keating. Her surname is Keating. It's good to call her by her surname Keating, but in the case note we do have they call her Janet. So we don't change what they call, because the what we address in the case note, the same thing we have done there. Rosalind will be moving to the house of her grandmother following discharge. So today she's going to get discharged, right? So she will be moving to her grandmother's house. It would be appreciated if you could continue home visit daily until the baby's weight and feeding become stable. So we have requested home visit in the purpose paragraph, requires daily follow-up visits. So if you could continue home visit, so we are requesting to continue the home visit daily until the baby's weight and feeding becomes stable. So kindly educate Miss Keatings. Okay, Miss Janet again. Sorry. Miss Janet and her mother regarding infant care. Please ensure the baby a safe environment and update the Department of Community Services in case of any risks. Okay, again, I have to use Janet multiple times because in order to avoid confusions, we have to use the name Janet multiple times here. I think we have used it around 4 times. It's not quite advisable to use this too often, but we don't have a way here to come out of the risks. So that's why it's important to monitor Miss Janet's coping and psychosocial state and provide an integrated support along with the drug and alcohol team. If not, Rosalind's medication details will be forwarded by her doctor. So this is the last sentence. So you do have a big paragraph there regarding the discharge plan. So where she'll be moving, till when she needs the visit, what you need to educate the mother and grandmother, what you need to provide the environment. So you need to monitor the psychosocial stage and integrate the service with the drug and alcohol team. All these lot of blah 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 are there. So we have entered all these things there. In case of any further information, please do not hesitate to contact me, yours faithfully, charge nurse, maternity ward. So that's it. We don't have any further complication. We have presented the matter. What happened to the child? The background information is given, and then the requirement is given. So that's a explanation here. Have a nice day. Thank you.